every time you eat, you're gonna get food stuck in between your braces. If you don't get the food out, it's just gonna sit there. And bacteria sitting on and in between your teeth like to snack on the food and produce acid. And acid is what breaks down your teeth and causes cavities. Here's how I recommend to brush and floss with braces. If you want to use a mouthwash, you can go ahead and do that first to loosen up any plaque in between your braces. Next, you'll want to floss. Flossing is super important. If you don't do it, you're really only cleaning 50% of your teeth. If you've used regular floss with braces, then you know how annoying it can be to thread the floss between each and every bracket. This is my favorite tool that I recommend to all my patients. It's called the Platypus braces flosser. Instead of struggling to thread the floss between all of your braces, you can just use the Platypus like you would a normal flosser. Platypus flosser has two ends, a skinnier end and a wider end. The skinnier end is designed to fit behind the wire. So when you insert the flosser, you'll want to make sure that skinnier end is fitting underneath the wire. If you try to floss over it, you're not going to get close enough to the gums, and if you try to use the big end, it's not going to fit underneath the wire, and you're more likely to pull the wire out or even pop some of your braces off. So you have to make sure that you're guiding that skinnier end under the wire. But once you get used to it, most people can floss their entire mouth without even using a mirror. After you're done flossing, you'll want to brush with a toothbrush. An electric or a manual is fine, as long as it's a soft bristled toothbrush and you're using a fluoride toothpaste. Remember, fluoride makes your teeth more resistant to acid and more resistant to cavities. Make sure to get above and below the braces. If you can hold the brush at an angle to clean the tops and the bottoms of the braces, that's going to be really important, because that's where I see most of my patients missing the most amount of plaque. I want you to lift your lip up and look and make sure that there's no extra gunk around the gum line. If you brush the plaque away and you start to notice there's white stains on your teeth, these are called white spots, and they're actually the beginnings of cavities. They are permanent. However, if this happens to you, proper brushing and flossing can gradually reduce their appearance over time. And after braces treatment, there are things that your dentist can do to make them less noticeable.